Mental health issues are now the leading cause of disability among young people aged 10 to 24 years around the world. According to research carried out by the Royal College of Surgeons for the Health Research Board in 2013, by the age of 13 years, 1 in 3 young people in Ireland is likely to have experienced some type of mental disorder. By the age of 24, that rate will have increased to over 1 in 2. Over 1 in 15 young people had engaged in deliberate self-harm, and by the age of 24, up to 1 in 5 young people will have experienced suicidal ideation. Census 2016 showed that the percentage of people with a psychological or emotional condition increased by almost 30% between 2011 and 2016. This included a 140% increase in mental health conditions among 13 to 19-year-old women and an 89% increase among adolescent men of the same age. Shockingly, 15% of 11 to 13-year-olds have already experienced significant psychological illness, according to some reports. As of May 2018, over 6,500 children and young people were waiting for their first psychological appointment. Ireland is one of the small minority of OECD countries where young people are more likely to commit suicide than older age groups. More likely to take their life, I should say, than older age groups. To address this, there is an urgent need to provide 24/7 access to mental health care for young people, including free access to counselling in schools and colleges, and to integrate mental health with the school curriculum. Crucially, there has to be a major funding in mental health services, a major increase in funding for major health services, and a major expansion of youth mental health services. I want to raise a point about the underlying cause, or a key underlying cause of these issues. I believe that the economic inequality, the exploitation, and the multiple forms of oppression which exist in class society, in capitalist society, are a major factor here. According to the late socialist writer Mark Fisher, he says, capitalist realism insists on treating mental health as if it were a natural fact like the weather. We need to ask, how has it become acceptable that so many people, and especially so many young people, are ill? The so-called mental health plague in capitalist societies would suggest that instead of being the only social system that works, capitalism is inherently dysfunctional, and that the cost of it appearing to work is very high. It is not an exaggeration to say that being a teenager is now close to being reclassified as a sickness. The pathologisation already forecloses any possibility of politicisation. By privatising these problems, treating them as if they were caused only by chemical imbalances in the individual's neurology and/or by their family background, any question of social systemic causation is ruled out. The psychologist Oliver James also links the increase in mental illness to neoliberal capitalism with its emphasis on individual competitiveness. The final point I want to make before handing over to Deputy Smith is that the Psychiatric Nurses Association are starting their industrial action today, and that's part of this debate and discussion, because as with the magnificent strike of INMO members yesterday, higher pay for psychiatric nurses is crucial to solving the crisis of recruitment and retention in mental health. On top of staff cuts and an ever-growing mental health crisis, low pay is one of the main causes of the chronic understaffing of mental health services and the endless waiting lists. Low pay for mental health workers stems from the wider problem of cuts and ongoing underfunding of mental health services. Even the Joint Committee on the Future of Mental Health Care found that, quote, pay is a significant factor hindering recruitment and retention, and therefore the problems in the mental health services are at root a problem of insufficient funding. According to the PNA, as of last summer, there were 500 vacancies for psychiatric nurses in the health service, but the total number of additional nurses needed to implement the government's long-term strategy, Vision for Change, is closer to 2,000. The number of mental health beds was cut from 12,484 in 1984 to 1,002 in 2016. So we need a major reversal of the cuts and increased funding in mental health services, and crucially a major increase in funding for youth mental health services.
Smith.